have XP, also known as Xeroderma Pigmentosum. XP is a rare inherited skin condition characterized by an extreme sensitivity to UV light. This means that I'm at a much higher risk of developing skin cancers and melanoma. These cancers can occur anywhere on my face, but they can also occur on my scalp and on the tip of my tongue. Any exposure I have to the sun can result in severe burn. I'm also at a risk for developing neurological problems and tumors. Skin cancers and other neurological deficiencies can shorten my life expectancy years, but my mom and I work very hard to keep me out of the sun to ensure that I can live up to approximately 37 years.
Xeroderma pigmentosum was first discovered in 1874 by Ferdinand Ritter von Hebra and Moritz Kaposi.
In 1882, Kaposi gave the term Xeroderma pigmentosum for the condition, referring to its characteristic dry, pigmented skin.
Nearly 100 years later, James Cleaver reported defective DNA repair in XP cells. This provided the link between sun exposure and DNA damage.
In 1874, Kaposi, along with Ibra, described 4 patients with parchment skin in the early textbook of dermatology.
1883, Albert Neisser reported 2 siblings who had XP with progressive neurologic degeneration.
Today it is recognized that about 25% of XP patients in the U.S. develop progressive neurologic degeneration.
When XP was first discovered, a common question among doctors was, what is XP on a molecular level? Xeroderma pigmentosum is caused by mutations in the genes that are responsible for repairing damaged DNA. DNA can be damaged by UV light from the sun and other carcinogens such as smoke from cigarettes. Normal cells are usually able to fix DNA damage before it causes harm to the organism. However, in people with Xeroderma pigmentosum, DNA is not repaired normally. As more abnormalities form in the DNA, the cell ceases to function and become cancerous and may die. Many of the genes related to XP are part of a DNA repair process called nucleotide excision repair, also known as NER. These proteins recognize DNA damage, unwind regions of DNA where the damage has occurred, excise the abnormal sections. Inherited mutations in the NER-related genes stop cells from carrying out one or more of these steps. There are around 9 different genes that may be altered in patients with XP. This includes certain genes on the following chromosomes: 2, 3, 6, 9, 11, 13, 16, and 19. So Cindy, what made you bring Taylor to the doctor in the first place?
Well, I didn't bring her into the doctors until about 6 months, because when she was first born, everything was normal. Her skin appeared normal. But then around 6 months, every time I brought her out into the sun, she would get these small rashes in certain areas, especially on her face. When I first brought her in, the doctor said that it was just normal rashes and just to be more cautious. However, after another year, so when she was a year and a half, it got a lot worse, so I brought her back in, and that was when the doctor diagnosed her with Xeroderma pigmentosum and explained that usually they're diagnosed between the ages of 1 and 2.
Yeah, XP is very hard to diagnose before then because it must be detected by obtaining a blood or a skin sample of the patient, and then after we obtain the blood sample, we measure the DNA repair factor. A carrier of XP can be detected using genes with coded samples of either peripheral blood lymphocytes or skin fibroblasts. This condition is inherited in an autosomal recessive pattern. This means that both copies of the gene in each cell have mutations. This means that both parents of an individual with XP have the mutated gene, but technically do not show the symptoms. Couples who both have the gene are at a greater risk of producing a child with XP. Parents who already have a child with XP have a 1 out of 4 chance of having another child with the disease. XP occurs worldwide and affects both men and women of all races. The frequency in the United States is about 1 case per 250,000 people. In Japan, the frequency is higher, and about 1 case per 40,000 people.
When people find out that Taylor has XP, a very common question is, can it be treated? There is no treatment for XP as there is no cure. However, there are a lot of things that can be done to help ease the symptoms. The most important thing that I can do for Taylor is protect her from UV light, and we do this by using 2 types of sunscreen. So we use a physical protective sunscreen and a chemically protective sunscreen. So the physical and the chemical differ in what they protect against in the UV light. Taylor goes for frequent skin and eye examinations once every 2 weeks. When Taylor is at her dermatology appointments, if they detect any cancerous tissues, it is removed immediately to prevent any spreading. Taylor is prescribed with isotretinoin, which is a vitamin A derivative that helps prevent the formation of new cancers. Taylor also goes for frequent neurological examinations, and she also has a therapist.
As patients with XP learn that there are no current treatments for the disorder, their next question is if there are any advances in their treatments. Unfortunately, there are no definite advances right now in the treatment of XP. However, many possible treatments have begun developing. The ex vivo skin gene therapy grafts the skin that has a genetic defect corrected. This could produce new skin cells that will eventually replace the defected skin cells. However, this method is still undergoing many tests and has not yet been cleared. Advances in photoprotection have also been made. Specifically engineered liposomes deliver a DNA repair enzyme into the skin. This means that it may be possible to repair DNA damaged by the UV light.